Good afternoon. Welcome to Marketplace 5. I'm Jessica Taloni, and joining us today is Dr. Barry Ripps from New Leaders in Fertility and Endocrinology, NewLife. And we've been talking about infertility. Today we're talking about one of the most common causes of infertility. And I've heard of this from friends. It's endometriosis. What is that?
Endometriosis is a condition where tissue grows in the wrong place. Just to make it very simple, tissue that belongs inside the uterus begins growing in other places. For instance, on the ovary or on the fallopian tubes. And that causes the body to react, and that's where you get the symptoms and the consequences of the endometriosis.
And so that's what it is, but what causes it?
You know, there's a Nobel Prize waiting for whoever discovers the cause. It's a complicated condition which we don't know what really makes a woman at risk. We do know that it seems to be more common in families. So if a mother or a daughter has it, a sister may be at risk as well. We also, a recent discovery, in fact, we published this in Boston this year, is that endometriosis seems to be associated with a lower ovarian reserve. So women who have that condition may want to seek fertility care earlier.
And what about the symptoms that go along with that? How would somebody that's watching know if perhaps that's the fertility issue they're facing?
The common symptoms are gynecologic. Pain with menstrual periods or pain with intercourse are the most common ones, but infertility is a symptom as well.
And what about the treatment that goes along with that? Because if it is the problem, certainly you've got a solution for it.
One of the first lines of therapy is fertility surgery. If the disease can be removed effectively, it can improve the chance of a spontaneous conception. For the more difficult cases, or if that prior therapy fails, in vitro fertilization works very well because the sperm and egg are allowed to fertilize far away from the disease itself.
Is there a way, though, to stop this before it starts? Can you prevent endometriosis?
You know, a woman who might be at risk because of a family history should be evaluated and consider using medications that reduce her risk of developing disease. An oral contraceptive, for instance, is very effective at reducing the amount of bleeding that a woman has with her menstrual period and reducing the pain associated with that menstrual period. So it's very effective in that respect.
And if someone's got questions about this, they should come and see you, see a specialist, and often insurance will cover that consultation.
True, and endometriosis is often treated as a gynecologic disease. Insurance will cover a woman's evaluation for infertility if it's associated with endometriosis.
All right, if you'd like to reach Dr. Barry Ripps, you can find him on Facebook. Look for NewLife on Facebook. The website is fertilityleaders.com. He's got an office in West Mobile and in Pensacola. For Marketplace 5, I'm Jessica Taloni.